Okay, good evening. Miss Judy Floranda-Estomo, preparing for foot assessment for my patient, patient D. Okay, so to start off, I will wash my hands first for sanitary purposes. Okay, wash your hands. Okay, so we dry our hands with paper towels for sanitary purposes, and then we'll get a sterile gloves for the foot examination. Right. We'll remove this later for the temperature. Check temperature. Okay. So we place it in the infectious waste, infectious bin. So, okay. So I'll introduce myself. So I'm Miss Floranda again, and this is my patient, patient D. I understand, Mommy, you have been diabetic for 8 years. So this ang purpose natin dito para makita natin, syempre, ang importante dito yung foot care, yung sensation ng mga legs natin, syempre mga extremities, yan, ang mga kailangan malaman para at least for better quality of life. Kahit na diabetic tayo, at least nando tayo sa precautionary measures na kailangan natin intindihin, lalo na syempre, pag meron tayong diabetes. Okay? So, to start off, so, have to check the legs of our patient. Okay? Yeah. Okay? So, for our patient, so, she agreed to have this foot assessment. So, to start off, so we check the legs for adequate exposure. So, expose naman po lahat ng legs ni Mommy so far. Ayan po. And then, we have to check if there are hair loss or skin changes. Mommy, meron bang skin changes? Skin discoloration so far? Okay, para makita natin na malinaw. Nagsalamin na si Ma'am. So far, wala naman po siyang hair loss or skin changes. Actually, meron pa talaga maano po kaya mga legs. And then, we'll check the toes for ulcers here. Dito po. Ayan po. Okay. So, we'll check the ulcers of sa toes po ng ating patient. So far, it's very clean and very clear. Dito naman po sa right. So far, okay naman po ang kanyang mga foot ulcers. Check for calluses if there are calluses of the feet. So far, Mommy, meron po ba mga callo naman? Meron pong konti because she's using rubber shoes as her coffee shoes. Okay, check if there are calluses. So far, wala naman po. Meron po kaunti-kaunti lang po. Dito lang pong side kasi she's using rubber shoes. Okay. So, we ask the patient to lift her legs, Mommy. Okay lang po ba i-lift yung legs? Ito po. Lift yung legs so far. The other one po. Are you having a hard time po sa pag-lift ng legs? Wala naman po. Okay. So, we have to feel the pulses of the legs. Okay. So, ni-remove na po natin para ma-feel po natin yung mga pulse ng legs. Have to put the use gloves on the infectious waste bin. Ayan po. Okay. So, you have to check the pulses of the patient. So, dito po. Okay. Dito po sa side na to. Dito po. And on the other side, ayan po. So, I feel the pulse properly po. So, after that, you have to check and feel the temperature of the legs of the patient. So far, kung warm ba siya, cold. So far, the legs of the patient is warm. Okay. Warm naman po ang kanyang temperature. Okay. After that, we have to compare the legs, the temperature of the legs. So, both of the legs are both warm, left and right po. So, after that, we have to check the capillary sa toes. So, check po natin ito. For 2 seconds. 1, 2. Ano ito ba? Okay, 1, 2. On the other side, 1, 2. So far, mami, may nararamdaman po ba? Wala naman po pag pindot. Okay. So, after that, we assess the pulses. Okay. So, tingnan po natin yung sensation ng ating patient sa mga sharps. So, we ask the patient to close her eyes. So, these are the sharps that we will use. Yung ginagamit din po sa glucometer. And they have to put the cover the use sharps here. Mami, can I request you to close your eyes po para ma-feel kung left or right po ang inyong nararamdaman. So, check po natin muna sa inyong hands. Okay, nararamdaman po ba, mami? Okay, nararamdaman po. So, close ang eyes po ng mami. Then, ito-click lang po natin ang bahagya. Okay. Left or right po? Left. Left. Right. Left. Left. Right. 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 Left. Left. Right. Okay. So we'll put it here in the used sharps. Then we have cotton here para ma-feel din niya if there are, she can still feel the sensation. So, ito po yung cotton na lang. Yung ganito na lang po. Just like sharps din po. Parang malaman po kung may kiliti si mami. Okay. Check din, mother, ha, kung close your eyes po kung left or right po, ha. Right. Left. Left. Right. Okay. So, place this in the infectious waste again. And then, after that, we'll check the distal phalanx or the toes to check if it's, kung alam po niya ito kung up or down. Okay? So, mami, check lang po natin ha, dito sa left. So, up and down. So, ito mami ha. Ready? 1, 2, 3. Down, down, up, 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 down, down. Okay. So, after that, we let the patient walk. Okay. So, mami, okay lang po ba? Kayo po yung maglalakad to assess if you have, kung okay lang po kayo na maglakad. Lalakadin lang po natin ating patient without slippers. Ayan po. Okay. So far, maayos naman po kanyang paglalakad. Mami, can I ask for your footwear? So, I will ask the footwear of the patient. Kung meron siyang tawag doon, kung mapudpud na po yung dulo. So, these are her present footwear na ginagamit po pag siya po ay mapasok sa call center. So far, wala naman po siyang yung pudpud po or pantay naman po. So, this is the right. So far, okay naman po. And this is the left. So far, no problem. And it makes, using rubber shoes makes her more comfortable. So, after this assessment, okay, so I would like to thank my patient D, for cooperating for our foot assessment. So, I would like to explain that the foot care of my patient is properly done, and then there are no signs of neurovascular deficits. Pulses are okay, and then temperatures are warm and okay. So, thank you very much, and this has been Miss Floranda for my foot assessment video presentation. Thank you very much. And the used sharps and the used will be thrown on the infectious waste. Thank you very much.